So hi, my name is Divine M. Dag-uman and I am your nurse for today. So for this video is that we are going to have an assisting blood transfusion. So what is blood transfusion? Blood transfusion is a medical procedure in which donated blood is being provided to a patient through a narrow tube that is placed in the arm of the patient. And also, it is a life-saving procedure that can help replace blood loss due to injury, trauma, and illness. So, to begin the procedure is that we need to review first the physician's order. So, in the physician's order, we need to take note also the date and time, the name of the patient, and also the order of the doctor to the patient. So here, it is being written by the doctor that we need to secure a packed RBC to a patient and it will be run or transfused for 4 hours. And also, we need also to take note here the name and also the signature of the physician. So after that, as a nurse, we need to secure a blood consent in which the patient will sign to confirm or to prove that the patient is being agreed to have a blood transfusion or the patient is agreed to have the procedure. And also on the separate sheet, it is the request form or blood request form, and it will be filled out by the church nurse for the information. So after the charge nurse fill out the information and the blood request form, at the back of that paper, it is to be signed, at the lower back, it is to be signed by the assisting or the physician. And also, the charge nurse will send this to the laboratory or in the blood bank. So once it is being received in the laboratory or in the blood bank, the medtech will immediately go to the patient's room to have a blood sample of the patient's blood for cross-matching or blood typing. So after the cross-matching or blood typing, once the blood is already available in the blood bank, the charge nurse will have a request form to release the blood from the blood refrigerator. So in the laboratory, we are going to confirm or to review the information in the sheet and also to the information attached in the blood bag. So in reviewing the information, it will be reviewed 4 times. So the first to review the information is the nurse and the medtech. Second will be the nurse and the charge nurse. Second is the nurse and the supervisor. And next is the nurse and the doctor. So to have a demonstration on how it is reviewed by the nurse and the doctor or the personals I have mentioned earlier is that it is like here. We need to review the name. What is the name, Miss?
Rosel Tarnate.
The blood component, which is packed RBC. It is packed RBC there.
Yes.
And then the blood type.
A+.
A+. And then the serial number.
214321.
214321.
Yeah.
And then the expiration date.
June 1.
June 1, 2001. Right?
Yeah. Yes.
So, it is being confirmed that the information in the sheet and also the information in the blood bag is colliding. So, after reviewing the information in the blood bag and on the sheet is that we are going to check for the blood bag for its the air inside, the color of the blood, the tubings, and also we are going to check for any leakage. So if there is none, there is no air present, there is no leakage present, So it is already ready for transfusion. And then afterwards, after reviewing or checking for the blood bag, we need also to prepare the other materials needed in the blood transfusion, which is the waste receptacle, the cotton balls, clean gloves, the blood set, the plaster, and also we need to have the thermometer for checking the vital signs, and also the blood pressure, which is the sphygmomanometer. We need also to prepare the blood bag itself with the blood inside. And also, we need to have the alcohol for the replacement of the alcohol swab. And then, after preparing the materials, is that it is ready to be given or to be placed at the side of the patient. So once we have bring the materials needed for the blood transfusion to the patient, is that we are going to introduce ourselves to the patient. So, hi ma'am, my name is Dag-uman and I am your assisting nurse for today. So, ma'am, may I know your name? And I will watch your wristband. What is your name, ma'am?
Rosel Tarnati,
And how about your birth date, ma'am?
June 30, 2003.
So, after introducing yourself and confirming the patient, is that we are going to make the patient understand or know the procedure we are going to do to her. We are going to check her vital signs. So, first, we are going to check the temperature of the patient. We need also to check for the blood pressure of the patient, the respiratory rate, and also we are going to take note the breathing patterns. So after checking the vital signs of the patient, and is that we are going to be assisted by a doctor for the confirmation again of the information in the sheet and in the information placed or paste in the blood bag. So after the confirmation is that we need to see the patient is having or having a plain NSS, and then we need also to check the site of the patient injection site for the patency. Make sure also that there is no sign of phlebitis, there is no sign of infiltration, and the site of the injection area of the patient is not swelling. And then we need also to take note also the cannula being used, which is gauge 16, 18, 19, and 20. And for some institution, they are using gauge 22. So after that is that we need to have a hand hygiene, which is we are going to wash our hands with running water and soap, or we are going to sanitize our hands through the use of alcohol or hand sanitizer. And then after doing the hand hygiene, we are going to wear our clean gloves. After wearing the clean gloves is that we are going to open the blood set. So in opening the blood set, we need to place this on the waste receptacle. And then for the blood set, we need to check for its tubing for possible leakage and possible cuts in the tubing. And then we need to maintain the spike of the blood set to be sterile as always. And then, we need to get the blood bag. It is because we are going now to insert the spike of the blood set to the blood bag. And on the original blood bag, since this is only an improvise, in the original blood bag, there is two holes. There is a two folded holes in which it is to be inserted by the spike of the blood set. And then in inserting the spike into the blood set, is that we are going to do it on the circular motion. And we need to do it slowly to avoid pricking the blood bag. So after that, we need also to maintain or to secure that the regulator is closed. And then once we ready the blood set, is that we are going to hang it into the pole. So, once we already hang the blood bag into the pole, is that we need to slightly press the chamber for having a little blood in the chamber. We need to fill it in halfway. And then we need to open the regulator and fill the whole tube. Once the whole tube is already filled with the blood, is that we need also to put it aside first, because we need to check the tubing of the plain NSS of the patient. So in the plain NSS, we need to stop the running of the plain NSS, and then the regulator is that we are going to move it to the patient's area or in the piggyback. And then once we already put the regulator near the piggyback or the injection port, is that we are now going to sanitize first the injection port. So in sanitizing the injection port, is that we are going to do it once in circular motion. And afterwards, we need to put it on the waste receptacle. And then we need to get back again the blood set with the needle. And then we need to insert the needle to the injection port. So in this portion, we are going to be careful in inserting the needle. We need to be careful in inserting the needle in the injection port to minimize or to avoid pricking the tubing or the tube. And then we need to use plaster for maintaining the connection of the needle or the blood set to the infusion set. So here, we have maintained the connection of the blood set and the infusion set through the plaster. We are now going to open the regulator slowly, just slowly, and we are going to monitor the patient's reaction or the body reaction of the patient from the transfusion. So we need to have a slow rate, and we need to put the regulator near the filter. Then we need to have a flow rate, and for 15 minutes we are going to be at the patient's side for the monitoring of the reaction. So after 15 minutes, if there is no reaction in the patient from the transfusion, is that we are going to regulate or regularize the flow rate of the blood. And then we are going to make our patient understand the situation or the possible happenings in administering the blood transfusion. So ma'am, karon nagsugod na ang atoang blood transfusion. Karon siya alas 8. And then ang gi-order sa doctor kay magkuan na atong blood transfusion for 4 hours. So alas 8 na karon ma'am, alas 12 ni siya possible nga mahuman. So okay ra ba na siya ma'am?
Okay ra.
And then ayon na lang sa kaybong ma'am nga magbalik-balik ko sa imuhang room kay akong from time to time akong i-monitor ang imuhang vital signs. Okay ra na siya ha? And then dili kayo ka magsigigluhag para dili matarog ang imuhang ang atoang blood transfusion. So okay ra ba na siya?
Yes, okay.
So after talking to the patient for the instruction is that we are going to do aftercare and documentation. So after 4 hours of transfusing the blood into the patient, the time for now is 12 in the midnight since we transfuse the blood on 8 p.m. So we presume that the pack RBC or the whole bag of the pack RBC is being consumed by the patient. So we are going to stop the infusion now. So first thing to do is to stop the regulator of the blood set. And then on the plain NSS, we are going to open the plain NSS. We need to open, and then we need to put the regulator on the near the chamber. So after opening, it is being included also to regulate or go back to the original flow rate of the plain NSS as the doctor's order to the patient also. And then afterwards, so after opening the regulator for the plain NSS, we need to remove the needle into the injection port. So here, we are going to have a safety measure in removing the needle. So we need to be careful. So first, we need to remove first the plaster. The plaster. And then, we need to be careful in getting the needle. And then, the blood set, the whole blood set, will be discarded into the right bin. Since it is already infectious or something, because we already transfuse it to the patient, we need to discard it to the right bin. And then after discarding the blood set, we are now going to sanitize also the injection port area. And then we need to place it on the waste receptacle. And then we need to have a gentle press into the tubing. So after that, we are going to do aftercare and document. That would be all. Thank you.